Good morning, everyone. Dr. Litvin here. I just saw a patient, a young man in his early 40s who came in referred by a plastic surgeon prior to doing a breast reduction procedure. And the young man tells me that this is something that's in his family, and he's had it for several years. And he's single, he has no children, he's a business person, and he's interested in doing the reduction now. He's got a serious girlfriend. And it took a while of prodding and questioning to get some answers to his issues. So apparently in his, sometimes in his mid-20s, he started going to the gym, and at some point he was interested in enhancing his results, and he went to a doctor, and at the time he was told that his testosterone was low, and he remembers that his level was around 200, and the doctor prescribed testosterone injections. So he was taking about 250 milligrams every week. Testosterone cypionate intramuscularly for about 5 years. He felt better, and afterwards he states that his results in the gym improved, and at some point he met another doctor who said that he should stop taking the injections and implanted testosterone pellets in his buttock. These pellets cause testosterone to be released, and they're in his system for about 3-4 months. And this continued with that doctor for another 6 years. So in total, it was about 11 years that he was on testosterone. Basically, several years ago, he states that he noticed that his breasts started enlarging. And in addition, he tells me that since he's met his girlfriend and they're interested in fertility, he noticed that he was having unprotected sex, and for 6 months she didn't get pregnant. Initially, he thought that, or they thought rather, that it was because of the fact that she was 40 as well, and although she was menstruating, they thought that maybe there's a problem there, so they went to see a doctor, and he had a sperm analysis done, and he's got no sperm. So the doctor gave him Clomid to take and said that they'll recheck his sperm count in several months. So this patient on physical exam has a wonderful physique. He's got minimal gynecomastia. He does have breast tissue bilaterally, but otherwise he's perfectly healthy, and he's got normal genitalia with normal sized testicles. I have no lab results to look at, but of course this is an upsetting story. When doctors who are not endocrinologists prescribe willy-nilly testosterone to healthy young men, selling them some kind of an illusion, but causing in the process a lot of damage. I blame the pharmaceutical industry as well for marketing this to primary care physicians. And of course, I'll be checking currently his pituitary gland, his thyroid, his adrenal gland, his testicles. But I did tell the patient that I thought that the gynecomastia was a minor issue, and that, of course, he should never return to receiving testosterone from non-specialists like an endocrinologist. And his focus now obviously should be on his fertility issues. And we'll follow him after I have some more lab results to see if this is indeed strictly related to testosterone administration, which is commonly seen in men, in addition to the azoospermia or lack of sperm, hypertrophy of breast tissue. But at the same time, we have to rule out potential other causes for gynecomastia. So mainly look at his thyroid and estradiol levels. The patient was very appreciative, of course, and will be followed here in a few weeks. Again, I'm outraged by this kind of administration of testosterone to young men without a workup, without proper follow-up, without concern for potential side effects, with damage to the sperm, with gynecomastia from pharmaceutical industry that couldn't care less, and from incompetent doctors who make these terrible decisions. So this is pathetic. Thank you for listening, Dr. Litvin.